Press your thumb gently into the front of your ankle tonight, hold it for 5 slow seconds, and then take it away. If a little dent stays pressed into your skin, like a fingerprint left in soft dough, your body is trying to tell you something. That small dent has a name. Doctors call it pitting, and it is one of the clearest signals that fluid is collecting in your legs where it should not be. Most people over 60 have noticed their ankles puffing up at some point. They blame the heat, or a long day on their feet, or their shoes being too tight. And sometimes that is all it is. But swollen legs can also be the very first message your heart, your kidneys, or your veins send when they are starting to struggle, long before anything shows up on a routine blood test. And there is one kind of swelling in just one leg that you should never wait on. I will tell you exactly what that one is before we finish. I am Dr. Daniel Mercer. For more than 18 years, as an internal medicine physician, I have had patients sit across from me, lift up the leg of their trousers, and show me ankles that have quietly doubled in size over a few weeks. Almost every one of them said the same thing. They thought it was nothing. They thought it would go away on its own. And so today I want to walk you through what swollen legs after 60 are really telling you in plain and honest language, so you know which kind is harmless, which kind needs a calm conversation with your doctor, and which kind means you pick up the phone today. Before we go any further, if clear, careful health information like this is useful to you, please take 1 second to like this video and subscribe to the channel. It genuinely helps me reach more people over 60 who deserve to understand their own bodies. It costs you nothing, and it means a great deal. Now, let us start at the very beginning, because once you understand why fluid pools in your legs, every warning sign afterward will make perfect sense. Your body is mostly water, and that water is constantly moving. It travels through your arteries out to your tissues, bathes your cells, and then needs to be carried back up to your heart so the cycle can begin again. Now think about where your legs sit. They are at the very bottom of your body, far below your heart, and gravity is always pulling that fluid downward, toward your feet. So your body has to work against gravity every single moment to push that fluid back up. When that pushing system works well, your ankles stay slim, and you never think about it. When something in that system weakens, fluid begins to collect in the lowest place it can find, which is right around your ankles and the tops of your feet. That collected fluid is what we call edema. The swelling itself is not the disease. The swelling is the smoke. Our job today is to figure out where the fire is coming from. Let me give you an everyday picture. Imagine a delivery truck that drives parcels up a steep hill all day long. As long as the engine is strong, the parcels get to the top and everything flows. But if that engine starts to tire, the parcels begin to pile up at the bottom of the hill with nowhere to go. Your circulation works in much the same way. When the engine that returns fluid to your heart starts to weaken, the fluid piles up at the bottom, in your legs. So the real question is never just, why are my legs swollen? The real question is, which part of the system is tiring out? And there are several possible answers, so let us walk through them one by one. The first and most common cause in older adults is something called venous insufficiency. I know that sounds like a mouthful, so let me make it simple. Inside the veins of your legs are tiny one-way doors, little valves, that are supposed to snap shut after blood passes through, so that blood can only travel upward, back toward the heart. As we age, those little doors can become weak or leaky. When they no longer close properly, some of the blood slides back down and pools in the lower leg. Picture a staircase where each step is supposed to catch you, but a few of the steps have gone soft, so you keep sliding back down. That backward pooling raises the pressure inside the veins, and that pressure pushes fluid out into the surrounding tissue. This is the most common reason people over 50 get swollen ankles. You will often notice it is worse at the end of the day, worse after standing a long time, and better in the morning after your legs have been level with your heart all night. You may also see ropey, bulging varicose veins, or a brownish staining of the skin around the ankle over time. The second cause is the one that worries me most as an internal medicine doctor, and that is the heart. Your heart is a pump, and when the pump weakens, a condition we call heart failure, it can no longer move blood forward as briskly as it should. Blood backs up behind the pump, the pressure rises in your veins, and fluid is forced out into your tissues. Here is the key difference I want you to remember. Heart-related swelling usually shows up in both legs, fairly evenly, and it often comes with other clues. The big ones are shortness of breath, especially when you lie flat or climb stairs, waking up at night feeling breathless, unusual tiredness, and a sudden gain in weight over just a few days as the fluid builds. Let me tell you about a patient I will call Harold. Harold was 71, and he came to see me mostly because his shoes had stopped fitting. He brushed it off as old age. But when I asked a few more questions, he admitted he had been sleeping propped up on 3 pillows because lying flat left him gasping, and he had gained 8 pounds in 2 weeks without changing how he ate. Those swollen ankles were not the problem. They were the warning light. His heart needed help, and because he came in when he did, we were able to help it. I want to pause on Harold for a moment, because his story holds a lesson for all of us. What struck me was not how sick he was. It was how easy it had been for him to explain everything away. The swelling, just getting older, the pillows at night. He had always slept better sitting up, he told himself. The weight, probably the holidays. Each clue on its own seemed small and forgivable. But lined up together, they painted a clear picture, and a picture his body had been drawing for weeks. That is the quiet trap with swollen legs. The body rarely shouts. It whispers, again and again, hoping you will notice. Harold noticed only because his shoes stopped fitting, of all things. So I want you to give your body more credit than that. When something changes and stays changed, treat it as a message worth reading, not a nuisance worth ignoring. The third cause sits with your kidneys. Your kidneys are the filters that balance the fluid and the salt in your body. When they are not working as they should, salt and water stay in your system instead of leaving in your urine, and that extra fluid settles, again, into your legs. Kidney-related swelling can also show up as puffiness around the eyes, especially in the morning. The fourth cause is your liver. A struggling liver can lower the level of a protein in your blood that normally holds fluid inside your vessels, like a sponge holding water. When that protein drops, fluid leaks out into the tissues, often pooling in the legs and sometimes in the belly. I am not telling you this to frighten you. I am telling you so that you understand why a doctor will sometimes order a simple blood test or an ultrasound when you come in with swollen legs. They are not overreacting. They are reading the smoke to find the fire. Now, not every cause is an organ in trouble, and this is important, so please hear me. Many cases of swollen legs come from causes that are far more ordinary. Sitting still for a long time is a big one. On a long car ride, a long flight, or simply a long afternoon in a recliner, the calf muscles stop squeezing the veins and fluid settles. The same thing happens with too much salt in the diet, because salt makes your body hold on to water. Warm weather can do it. Being overweight can do it, by putting extra pressure on the veins in the legs. And in women, hormonal changes can play a part. There is one more cause I have to mention clearly, because it surprises so many people, and that is medication. A number of very common, very legitimate medicines can cause the ankles to swell as a side effect. Some blood pressure pills, especially a group called calcium channel blockers, are well known for this. Certain pain relievers, some steroids, and a few diabetes medications can do it too. Now I want to be very careful here, and I want you to hear me say this plainly. If you suspect a medication is swelling your ankles, you do not stop it on your own, not ever. You bring it to your doctor. There is almost always a good solution, whether that is an adjustment or a different option, but that is a decision you make together with the person who prescribed it. Please write that one down. Never stop a prescribed medicine on your own. Talk to your doctor first. So by now you can see the pattern. Swollen legs are a signal, and the signal can be coming from your veins, your heart, your kidneys, your liver, your habits, or your medicine cabinet. That is exactly why you should not simply ignore swelling that is new, that is getting worse, or that will not go away. But now I need to slow down and tell you about the one kind of swelling that changes everything, because this is the part of today's video I most need you to remember. Almost everything I have described so far affects both legs, more or less evenly, and it tends to come on slowly, over weeks. But if one leg suddenly swells up on its own and the other leg looks completely normal, that is a different situation entirely, and it needs urgent attention. That sudden, one-sided swelling, especially when the leg is also painful, warm to the touch, red or darkened, or tender in the calf, can be a sign of a blood clot deep in the vein of the leg. Doctors call this a deep vein thrombosis, a DVT. According to Mayo Clinic and the United Kingdom's National Health Service, this is a medical emergency because a piece of that clot can break loose, travel up to the lungs, and cause a life-threatening blockage. So please hold on to this rule. Swelling in both legs that comes on slowly is usually something to discuss with your doctor at your next visit. But sudden swelling in only one leg, especially with pain, warmth, or redness, means you do not wait. You contact your doctor right away, or you go to urgent care or the emergency room the same day. And if that one-sided swelling ever comes together with sudden chest pain, shortness of breath, or coughing up blood, that is the moment to call your emergency number, which is 911 here, immediately. I would much rather you go in and be told it was nothing than stay home and miss a clot. That single piece of knowledge is worth more than this entire video. Now let me give you the gentle, sensible things you can do at home for the ordinary, both legs kind of swelling, the kind that comes from standing too long, a little too much salt, or tired leg veins. None of this replaces seeing your doctor, but these are the steps I share with my own patients. The first and simplest is elevation. Once a day, lie down and prop your legs up on a couple of pillows so your ankles sit above the level of your heart for 15 to 20 minutes. This lets gravity finally work for you instead of against you, draining the pooled fluid back toward your center. Doing this in the afternoon or early evening, before the swelling peaks, works best. The second is movement, and this is where a small change makes a big difference. Your calf muscles are a second pump for your legs. Every time you flex your feet, those muscles squeeze the veins and push fluid upward. So if you sit for long stretches, set a gentle reminder to get up and walk for a few minutes every hour. And even while seated, you can pump your feet up and down at the ankle, pointing your toes and then pulling them back 20 or 30 times. It looks like nothing, but it gets the fluid moving. On a long car trip, stop and stretch your legs. On a long flight, walk the aisle. The third is being mindful of salt. You do not need to live on bland food. But the saltiest things in most of our kitchens are not the salt shaker. They are the hidden ones: canned soups, deli meats, frozen dinners, and restaurant portions. Reading a label and choosing a lower sodium version once or twice a day can quietly reduce how much water your body holds. The fourth, and many of my patients find this one the most helpful, is compression stockings. These are special snug socks that gently squeeze the lower leg, supporting those tired veins and helping push fluid upward. They are inexpensive, and you can find them at most pharmacies. I would add one word of caution here, which is that if you have circulation problems in the arteries of your legs or diabetes with nerve issues in your feet, you should check with your doctor about the right strength before you buy them. Now let me be very clear about the common mistakes I see so you can avoid them. The first mistake is ignoring swelling that is new or steadily worsening and just buying bigger shoes. The shoes are not the answer. The second mistake is assuming all swelling is harmless because it has happened before. The third, and the one I beg you to avoid, is treating sudden one-sided swelling like the ordinary kind and waiting to see if it gets better. It does not get the benefit of the doubt. The fourth mistake is stopping a medication on your own because you suspect it. Always loop in your doctor. Let me talk about who especially needs to check in with a doctor rather than simply trying home steps. If your swelling is brand new and you do not know why, if it is in only one leg, if it comes with shortness of breath or chest discomfort, if you have a known heart, kidney, or liver condition, if the skin over the swelling is breaking down, weeping fluid, or looks infected, or if you have suddenly gained several pounds in a few days, please make that call. These are the situations where the swelling is most likely speaking on behalf of an organ that needs attention. Here is the one habit I want you to build, because it turns all of this into something you actually use. Once a week in the evening, do a simple 10-second self-check. Sit down, press your thumb gently into the front of each ankle and shin, and notice three things. Does a dent stay behind? Are both legs the same, or is one bigger than the other? And does it feel warm, tender, or painful? Pick a regular evening, perhaps Sunday, and tie it to something you already do, like sitting down after dinner. That tiny weekly check is how you catch a problem early, while it is still easy to help. And here is a small bonus that stacks right on top of that habit. Whenever you sit down to watch your evening program, slip a pillow under your feet and let your legs rest up high for those 15 minutes. You are doing your weekly check and your daily drainage at the same time, in a moment that already exists in your routine, without adding a single chore to your day. So let me bring it all together. Swollen legs after 60 are not a disease in themselves. They are a signal, a wisp of smoke, and the smoke can be coming from tired leg veins, from your heart, your kidneys, your liver, from long sitting and too much salt, or from a common medication. Slow swelling in both legs is something to raise calmly with your doctor. Simple steps, elevating your legs, moving your calves, easing off the salt, and compression stockings can help the everyday kind. But sudden swelling in just one leg, especially with pain, warmth, or redness, is the one that does not wait. That is the day you call your doctor, go to urgent care, or head to the emergency room. Your legs are talking to you. Now you know how to listen. If this helped you understand your own body a little better, please subscribe and stay with us here. This channel exists to help you read the signs your body gives, so you can stay strong, steady, and independent well past 60. Take good care of yourself, and I will see you in the next one. One last and important note. This video is for general educational purposes only, and it is not medical advice. Always speak with your own qualified healthcare provider before making any changes to your diet, your activity, or your medications, and never stop a prescribed medicine on your own. Your doctor knows your body and your history, so bring these questions to them and let them help you use this